I'm Jessica Hoffman and I'm 37 years old. I live in Dixon and I have worked at Phelps Health for 4 years now. I'm currently an analyst on the Epic team, which is our electronic medical record system. So when the vaccine was first available for COVID, I was hesitant. Admittedly, I was wanting more data to show the effectiveness of the vaccine and that it was safe, and so I just put it off. And since I primarily worked from home, I just kept putting it off. This past summer I did contract COVID-19. I tested positive on June 28th. I went to the Raleigh ICC. My symptoms were kind of the classic symptoms: shortness of breath, cough, weakness. I also had a terrible headache, and so I went to the ICC here in Raleigh, got tested, and it was positive. And that was on a Monday, and I went home and just tried to take care of myself, and I was getting worse, and I thought well, this is just running its course. It's going to get worse before it gets better. That weekend was the 4th of July, and I stayed home, of course. And so that Tuesday, July 6th, I finally decided that my breathing was just getting worse, and I was getting shortness of breath, and just all my symptoms I had were just getting worse. And I think I was barely eating by then because it was just too much to try and do. And so I came to the emergency room here at Phelps Health, and they admitted me as an inpatient, and that was on a Tuesday, July 6th. You know, they started treatments right away. I received convalescent plasma, but unfortunately I just progressively got worse. And by Saturday, the 10th of July, around midday, they transferred me to the ICU at Phelps. And none of the treatments that they were working were helping. My oxygen sats were still too low. And late that night, crossing midnight, I was intubated. By Monday the 12th, I was septic, my kidneys shut down, and just very, very sick. And so I was flown up to St. Louis and I was admitted up at SLU. And I was on a vent for 3 weeks. I was at SLU for about 43 days total, and I had a trach put in at one point, but they were able to remove it, so that allowed me to come back to Phelps Health, actually, to the inpatient rehab floor, where they helped me regain my physical ability to walk and such. I know when I was there for 3 weeks, and when I first arrived, I couldn't even pull myself up on the side of the bed to sit up. If someone helped me, I could sit, but I couldn't do it on my own. But the staff here was wonderful. The physical and occupational therapists and the nurses and doctors, the care I received was just really amazing. And with the help of the therapist and the intensive therapy every day, I was walking with a walker after 8 or 9 days. My steps were really slow and not very far, but just in that short amount of time I was able to make a lot of progress. So I was in the hospital between Phelps and SLU, and then Phelps again for 74 days total. My parents pulled their RV up to St. Louis, close to the hospital, so that they could come see me every day. And because of COVID visitor restrictions, only one visitor was allowed per day, so my mom was there almost every day. When I was on the vent, I know my dad would come see me, and my brother came down from Montana to see me. But it definitely impacted their lives. It virtually halted my parents' lives as they were there every day just hoping for me to get better. And I know those first couple of weeks were really rough. The doctors were giving my parents very low odds of survival, but I pulled through. A lot of people say that, 98-99% of people survive COVID, which is true, but that statistic doesn't include people like me who I did survive, but it's been a challenging journey as I've had to recover. I missed 4 months of work. It's been a life-altering experience for me. I will forever be changed by my time in the ICU, and I'm still battling with some lingering COVID symptoms. One of the medications that they had me on when I was first on the ventilator is a vasopressor, which is a heart medication, and it constricts your blood vessels and helps with your blood pressure and things like that. But while the other treatments that they're giving you are helping to make sure that blood is still pumping through your heart and your other major organs, your fingers and toes are the lowest on that pecking order to make sure that blood is pumping. So unfortunately, my fingers developed, they became necrotic, and I had to eventually have 3 fingertips amputated, and it's on my dominant hand, so it's made recovery a little bit extra challenging. But for me, that's something that even if all my other COVID symptoms go away, I'll always be missing a part of my hand because fingers don't regrow. But I think it's really important for people to realize that COVID can impact your life for a long time. I mean, there's people who are not as sick as I was, but are in worse shape than I am currently. I've been so fortunate to recover as well as I've had, even though I've had many challenges. I'm here to be able to share my story, and I just wanted to take that opportunity to do so, just to let people know that it is serious, and it can make a huge impact on your life. Some people lose toes on that medication that I was on, so thankfully that didn't happen to me. But my story would be very different if I would have been vaccinated before. I never really considered that if I were to contract COVID that I would get as sick as I did. I thought maybe I would struggle a little bit more than other people. Maybe I would be sick, just for a longer amount of time than, because I've had coworkers and friends who had COVID who were, the worst of it was maybe 2 weeks for them, a week or so. But so I thought maybe I'll just struggle a little bit longer than them. Like, I never imagined what happened would actually happen. And so, even though I'm technically high risk because of my autoimmune disorder, I still thought my age would help me. And so, while I wasn't officially tested, most doctors thought that I had the Delta variant of COVID. And they have seen where younger and younger people are getting sick, severely sick with COVID, and they have the Delta. So I think that probably played a factor in it as well. Before I was sick, I had not been vaccinated, and most of my family had not been vaccinated either. And the first week I was on the ventilator, a lot of my immediate family went and got vaccinated. And I know that a few of my friends went and got vaccinated. And I remember sitting in the hospital thinking, as soon as they let me, after I woke up and everything, as soon as they let me, I'm gonna get the vaccine, because I didn't want to get that sick again. I wanted to do whatever I could to protect myself. But also, I really wanted to do my part to help protect others, to prevent the spread of COVID, and just, I just feel like it's really important to protect yourself and protect others, because currently our numbers are rising in our community, and it's very scary. So one of the other reasons why I wanted to get the vaccine was because I didn't want anyone to go through what I've had to go through, and I especially didn't want anyone's family and friends to go through what mine did, because it was very hard on them. I've had friends tell me they didn't know if they would get to talk to me again, and so it was a traumatic experience for them as well, watching a loved one be on the vent. And one of the things I was hesitant on was I didn't feel like there was enough data out there, but the vaccine's been available for almost a year now, and the data's there proving its effectiveness to prevent people from hospitalization and from ultimate death. And while you can still contract COVID if you're fully vaccinated, the studies are showing that it's not as bad. You don't get as severely sick. And so I think now, as we're facing another variant and another surge in numbers, that the data's there, and there's always a risk with medications and vaccines, but those are exceptions, I feel like. And so for me, I felt like it was safe, and I wanted to just be able to protect myself and protect others.